Hi, I'm Cathy with Level Up RN. In this video, we are going to talk about respiratory system diagnostic tests and labs. At the end of the video, I'm going to give you guys a little quiz to test your knowledge of some of the facts I'll be going over in this video. Let's start off by talking about arterial blood gases, or ABGs. So I actually have a whole other playlist that is totally dedicated to ABGs and interpreting ABGs. So if you need any help with that, then definitely check that out at some point. So ABGs assesses the acid-base balance and the oxygenation of critical care patients and patients with acute or chronic respiratory disorders using a sample of their arterial blood. There are 5 key components of ABGs. The first is the pH, which should be between 7.35 and 7.45. Then we have PaCO2, which is the partial pressure of carbon dioxide. That should be between 35 and 45. Then we have bicarbonate, or HCO3. That should be between 22 and 26. Then we have our PaO2, which is the partial pressure of oxygen. That should be between 80 and 100. And then we have our SaO2, which is really the oxygen saturation of the arterial blood. That should be between 95 and 100%. So another way that we can assess our patient's respiratory status is through pulse oximetry. So the patient's SpO2 should be between 95 and 100%. However, if we have a patient with COPD, they will often have SpO2 levels that are in the low 90s, and that is expected for a patient with this condition. And then lastly, we have pulmonary function tests, or PFTs, and these can be really helpful in diagnosing asthma and COPD in patients. All right, now let's talk about a bronchoscopy, which is insertion of a tube into the patient's airway that allows for visualization of that airway as well as the collection of specimens. In terms of nursing care, pre-procedure, we want to make sure the patient has been NPO for the prescribed amount of time, which varies between 4 and 8 hours. We also want to provide the prescribed medications, which allow for sedation of the patient during the procedure. Then post-procedure, we want to make sure that the patient's gag reflex has returned before we provide them anything to eat or drink. You also need to provide patient teaching that a sore, dry throat and blood-tinged mucus is expected. And then of course you want to monitor your patient for complications such as a pneumothorax, which we will talk more about as we go into detail about critical care topics in this video playlist. Next, let's talk about a thoracentesis, which involves the insertion of a needle into the patient's posterior chest to remove fluid or air from the pleural space. So pre-procedure, you want to have the patient sit upright and their arms should be supported on their bedside table or on pillows. And during the procedure, they need to remain perfectly still. So you need to advise them not to talk, move, or cough when the thoracentesis is being performed. After the procedure, you're going to want to monitor them for complications such as a pneumothorax, bleeding, or hypotension. A chest x-ray can be performed if complications are suspected. And then you want to advise your patient to take nice big deep breaths to help expand those lungs after the procedure. Okay, you guys ready for your quiz? I have 3 questions for you. First question. An SpO2 of 90% is an expected finding in a patient with COPD. True or false? The answer is true. Question number 2. Before allowing a patient to eat or drink after a bronchoscopy, what assessment do you need to make? The answer is you need to make sure that the patient's gag reflex has returned. Question number 3. How would you position your patient for a thoracentesis? The answer is you would have them sit upright with their arms supported on the bedside table or on pillows. So hopefully you did well on that quiz. If not, you can go back and watch the video or review our cards again. Take care and good luck studying. I invite you to subscribe to our channel and share a link with your classmates and friends in nursing school. If you found value in this video, be sure to hit the like button and leave us a comment and let us know what you found particularly helpful.